Hi, I'm Dr. Julia Turner, and I'm going to tell you everything I think you need to know about coronavirus. So to start off with, you need to understand what these three words are. So coronavirus is the name of the family of viruses. Now this includes SARS virus, MERS virus, and now SARS virus 2. So SARS stands for Severe Acute Respiratory Syndrome, and MERS stands for Middle East Respiratory Syndrome. SARS-CoV-2 is the abbreviation for the virus, which is SARS coronavirus 2. Then COVID-19 is the actual disease that is caused by the virus SARS-CoV-2. COVID-19 stands for coronavirus disease 19 because it was found in 2019. Well, we've all seen as the numbers have increased dramatically from when it was first discovered in Wuhan, China, to now over 2.3 million cases, over 150,000 deaths around the world. We're having over thousands of deaths daily in over 170 countries. Around the world, we've seen a case fatality rate on average of about 4%, which means that 4 out of 100 people with coronavirus are dying. We can't tell if this is the exact fatality rate of coronavirus because the testing capacities in different countries have been different. So unfortunately, initially South Africans didn't take the social distancing guidelines seriously enough, and our graph was increasing rapidly with new cases. But after the lockdown, you can actually see the effect that it's had, in that it has eventually flattened our curve. So you can see that Hong Kong, Singapore, and Japan, they did very, very well in flattening their curve. But we have done quite well with South Africa during the lockdown period as well. So realistically, South Africa could lose many people. It's estimated that between 50 and 250,000 South Africans could die. So how can you get coronavirus? So coronavirus can spread when someone coughs, sneezes, or speaks. They release little respiratory droplets with the virus in it. Now these droplets can travel through the air and enter someone's eyes, nose, or mouth if they are standing nearby. These droplets also settle on any surfaces that are nearby, on clothes, on plastic or metal, on pens, on shopping trolleys, on tables and chairs, and on the person's hands. Now if you shake hands with them or you touch any of those surfaces and then you touch your face, you can become infected. If you also use any cups, knives and forks, any eating utensils, and then someone else uses them afterwards, they can become infected. Can coronavirus be spread through the fecal-oral route of transmission? So at the moment we do know that coronavirus has been found in feces, but we haven't had any documented cases of fecal-oral transmission. So at the moment we don't think that you can get coronavirus from being in contact with someone else's feces, i.e. from the toilet. And mother to child, can the coronavirus spread from a mother to the child? No, we don't think so. There haven't been any cases documented of this, and we haven't found coronavirus in amniotic fluid, in the birth canal, or in breast milk. So at the moment, the main form of transport of coronavirus is through respiratory droplets. It's important to note also that the virus can be transmitted when someone does not have symptoms, and this is usually the 2 days leading up to them having symptoms. They can in fact transmit coronavirus. This is what makes it so scary, because people can transmit coronavirus without even knowing that they are sick. So how long can coronavirus survive on different surfaces? Well, some recent data shows that on some surfaces, such as plastic, it can survive up to 5 days. This is why it's really important to wash surfaces regularly. Now we'll discuss how can you tell if you have coronavirus. So what symptoms should you be looking out for? The most common symptoms are fever and cough, although you don't have to have both. Some people only have a cough and no fever, or fever and no cough. The third main symptom is shortness of breath, but this only occurs in less than a third of patients. Other symptoms which may be present are body aches and tiredness, loss of appetite, sputum production, so this means a productive cough as opposed to just a dry cough, and occasionally people may have headache, sore throat, or diarrhea, although these are not as common. Some people with coronavirus can get some strange symptoms like losing their sense of smell and losing their sense of taste. I quickly want to explain what a fever is, because in South Africa many people refer to a fever as being a flu, so symptoms of sneezing, coughing, etc. In this case, we are actually talking about a fever being a temperature, meaning that your body is hot. You might feel hot and then cold and then hot again. This is what we are referring to as a fever. The most dangerous symptom to look out for is shortness of breath. If you're having any difficulty breathing, feeling like you have to breathe very hard or very fast, then please go to hospital immediately. It's not possible to tell just by symptoms whether you definitely have coronavirus or not, so you have to actually test for it. And the test that we are doing at the moment is a nasopharyngeal swab combined with an oropharyngeal swab. That basically means the doctor will have to put a little swab, which is like an earbud, into your nose and into your mouth, and then we send it off to the lab. Other tests that can be done are sputum samples and blood tests. In South Africa, we have strict criteria to determine who should be tested for coronavirus. The NICD is currently changing these criteria as the pandemic changes. So please check what the latest version is at your time. At the time of me doing this video, our criteria is that you have to have one of these 4 symptoms, either a cough, fever, difficulty breathing, or a sore throat. And the criteria to define a high-risk patient is someone with any of those symptoms, but as well having a known positive or suspected contact, having traveled to or living in a place with local transmissions, or a healthcare worker or someone working in a facility with positive cases. So who is a contact? Is it anyone you pass in the corridor? No. So NICD have strict definitions of what a contact is. In general, you have to have spent at least 15 minutes within 1 meter of an infected person to be called a contact. So it can be people who live together or work closely together, who travel together, or a healthcare worker or someone else who's cared for a patient who tested positive and they were not wearing protective gear. If a healthcare worker was wearing the necessary protection, then they are not considered a contact and they don't have to be quarantined. This is one of the very important reasons why it's so necessary that healthcare workers wear the necessary protection. Besides for their own safety, it also means that they can continue working. If all our healthcare workers have to be quarantined for 2 weeks after seeing a positive patient, then we'll have no healthcare workers left to work. So what happens if you get coronavirus? So you'll have to go into isolation, and this can be done at home or in the hospital, depending on whether you have mild or severe disease. If you don't have your own bedroom at home, then you'll have to go to a government or private quarantine or isolation site. Everyone that you've been in contact will have to be traced and monitored for symptoms and tested if necessary. So how sick do people get? Well, looking at the data from around the world, if we take 100 people with coronavirus, about 40 of them will have mild disease without pneumonia, another 40 of them will have moderate disease with pneumonia, 15% will have severe pneumonia and need hospitalization and oxygen, and about 5% will have critical illness and need ICU and might die. I'm now going to tackle the awful subject of who has the most chance of dying from coronavirus. So from the data from China, of 44,000 people, we saw that people under 40 years had a very low chance of dying. However, from 50 to 59 years old, the chance increased to 1.3%, which is 1 in 76. From 60 to 69 years old, it increased to 3.6%, which is 1 in 27. And from 70 to 79 years old, it increased to 8%, 1 in 12 people, and over 80 years, 14%, which is 1 in 6 people died. So you can see that there's much higher risk of dying if you're over 50 years old, and this risk increases exponentially as you get older. So some people also had underlying disease, and this caused them to have much more severe disease. So who was this? So it's people with high blood pressure, diabetes, heart disease, lung disease, liver disease, kidney disease, and immunodeficiency disease. So in South Africa, we have people with all of these diseases, so we are very worried about them. We also have the added burden of HIV and malnutrition, which causes a lot of immunodeficiency. And we have lots of people with TB, which causes lung disease, that we are worried about. So you might be wondering, what about pregnant ladies? So we haven't seen an increased mortality rate for pregnant ladies from coronavirus compared to if they weren't pregnant. And we also haven't seen any direct mother-to-child transmission. That is, that we can't find coronavirus in amniotic fluid, in the birth canal, or in breast milk. So it's still safe to have a baby and breastfeed, but the most likely route of transmission that your baby would get coronavirus from you is from your respiratory droplets. So if a mother has coronavirus, they need to wear a mask while they breastfeed. They need to take every precaution possible to not spread it to their baby. So in summary, the people we really need to protect are the elderly, anyone with any other illness, and of course pregnant ladies we want to protect as well, because we never know what long-term effects it might have on a baby. If you are any one of these people, please take all precautions not to get coronavirus. So now let's look at what we as South Africans can do to protect ourselves from coronavirus. So remember how coronavirus is spread through respiratory droplets. After someone coughs, sneezes, or speaks, they can go through the air and go into your eyes, nose, or mouth, or they can land on surfaces, and then anything you touch, you can put them in your face. So the best thing to do is to stay away from all people, especially anyone with a cough or a fever or who's sneezing. Stay at least 1 to 1.5 meters away from everyone else. Wash your hands regularly. Every time you touch something, then you must wash your hands afterwards. Preferably before and after you touch anything, you wash your hands. Definitely don't touch something like your cell phone or a shopping trolley and then touch your face afterwards. You must wash your hands before you then touch your face. Clean all the surfaces that you have to touch. So if you've gone out somewhere, come back, clean your cell phone, clean your handbag. You can use a bleach solution to do this. And don't share utensils that someone else might have eaten with or drunk with. So the best way to wash your hands is with good old water and soap, and to wash your hands thoroughly for 20 seconds. If you don't have water and soap, you can use a hand sanitizer, but it must be above 70% alcohol, or you can use a bleach and water mixture. So in South Africa, we have about 7.7 million people with HIV. About 5 million of them are on ARVs, and about 2.7 million are not. Those who are on ARVs, most of them have a suppressed viral load and a good CD4 count, which means that their immune system is strong and can fight diseases. Some people, however, have not been taking their ARVs correctly and may have a high viral load and a low CD4 count, which means that their immune system is weak and cannot fight infections. The people who aren't on ARVs might not know that they have HIV, or they might have stopped taking their ARVs. So the people who have a suppressed viral load and a good CD4 count most likely don't have any increased risk of getting severe coronavirus. However, we don't actually know this because we haven't seen coronavirus in this population yet, but we don't anticipate that these people will be more sick than people without HIV because they are taking their treatment well. But these other people may be at risk of severe coronavirus. So we ask that anyone who doesn't yet know their HIV status and might be at risk to please come and test for HIV so that you can start ARVs. If you've previously stopped taking your treatment, please restart immediately. And if you have a high viral load and a low CD4 count, please come to clinic so that we can get you onto the right ARVs for you and get your viral load suppressed. We want to get you rather in the group of people who will not be at high risk of severe coronavirus. We also encourage everyone with HIV to get a flu vaccine. This is to prevent you from getting flu so that it can't damage your lungs, as you don't want to have flu as well as coronavirus. So TB in South Africa is also very high burden. We get about 250,000 people every year with TB, and there's a higher chance if you have HIV and a low CD4 count. So if you have a TB contact or a cough or fever or night sweats or loss of appetite or loss of weight, please come to the clinic and be tested for TB so we can get you on treatment quickly. We don't want people to have TB and not be treated and then get coronavirus as well, as both of these conditions affecting the lungs will likely result in very severe disease. And if you're HIV positive and you haven't had TB prevention therapy, please come to the clinic to start TPT so we can prevent you from getting TB. In South Africa, we also have many people with other chronic illnesses. If you have high blood pressure or diabetes, please make sure that your sugar and your blood pressure are stabilized. Please take your medicine for your chronic illness. Please take all precautions to prevent yourself from coming into contact with coronavirus. So what is social distancing? It basically means staying away from all people. If you have to make contact with people, then you must stand at least 1.5 meters away from anyone else so that if they cough or sneeze, the respiratory droplets will not reach you. So no social gatherings should take place at all. Public transport should be avoided. Pubs, bars and restaurants should close. Sports events and gyms must close. Schools and universities should close, and workplaces, where possible, people can work from home. Churches, synagogues and mosques must close. So if we don't use social distancing, one person would infect 2.5 people in 5 days and 406 people in 30 days. Whereas if we practice social distancing and we have 50% less exposure, then one person will only infect 1.25 people in 5 days and 15 people in 30 days. If we increase the social distancing and have 75% less exposure, we would only have 2.5 people infected in 30 days. So you can see here the dramatic improvement in the numbers of people who would be infected if we practice social distancing. You might have heard us talk about wanting to flatten the curve. Well, this is what we mean. So in the red graph, you can see the number of cases increasing daily very quickly. This is when you don't practice social distancing. But if you do put in social distancing measures, then the spread will be much slower. And even if the same number of people become infected, it'll happen much slower, one at a time, and this will then flatten the curve so that the health system can actually cope with the load. So instead of all 10,000 people needing hospital beds at the same time, they rather can be staggered and maybe 10 people a day need a hospital bed. This means that our health system can actually cope with the people who are sick and help them survive so they don't die, even though people are still becoming infected. So we didn't make up these graphs. You can see it in real life from an example in 1918 when a flu virus hit 2 cities in America, Philadelphia and St. Louis. In Philadelphia, the authorities didn't think it was too serious and let everyone continue with their public gatherings. you can see how the number of people who were infected and died increased dramatically over a very short space of time, leaving a lot of people dead. Whereas in St. Louis, they put in very strict social distancing measures, so people did not infect each other very quickly. So only one by one people got sick and infected, but the health system was able to look after these people, so the death rate was much, much lower. This is what we mean by flattening the curve. So unfortunately, initially, South Africans didn't take the social distancing guidelines seriously enough, and our graph was increasing rapidly with new cases. But after the lockdown, you can actually see the effect that it's had, in that it has eventually flattened our curve. So you can see that Hong Kong, Singapore, and Japan, they did very, very well in flattening their curve, but we have done quite well with South Africa during the lockdown period as well. You'll be glad to know that many international organizations, research institutions, and pharmaceutical companies are trying very hard to develop vaccines and treatment for COVID-19. Many clinical trials have already started, and some will be starting in South Africa shortly. We are very hopeful that we will develop a vaccine or treatment. However, we cannot bank on this, as sometimes vaccines and treatment can be difficult to produce. Our government in South Africa has been very proactive in managing the coronavirus pandemic. We started national lockdown early, which was very, very necessary, and we've done well with that. We're now implementing countrywide screening and testing. The idea is that we are trying to find the small fires and put them out. So find the people with coronavirus and isolate them so that no one else becomes infected, rather than dealing with big fires, lots of people having coronavirus, and then we can't deal with it. We're also at the same time massively increasing the capacity of the healthcare system. We're setting up fever clinics, big testing centers. We're changing the setup of all clinics and hospitals so that you always start with screening before you get into the facility, so we don't spread coronavirus. And we're training staff on ICU measures, increasing our ICU capacities. We're putting screening and sanitation systems in place in all healthcare settings, as well as all other departments. This is the time that is needed for everyone to put these systems in place, because we need to start planning to adapt for a physical distancing way of life. Even after lockdown, we are not going to go back to normal life. So please, all businesses, all organizations must start adapting their processes, their protocols, so that they can do as much as possible from home and put in every precaution that's necessary. And at the same time, we're also working on finding treatments, doing scientific studies to find out which treatments work, how much, and what doses, etc., so that when our people do become sick, we can manage them better. I now call on you, the people of South Africa. We need each and every one of you to pull your weight in order to fight this disease. Please practice social distancing. Look after your own health. Have the tests that I've suggested and take your chronic medication. Protect the elderly and people with other illnesses. Do not transmit this illness. Take all preventative measures to decrease transmission by washing your hands and surfaces and staying away from other people as much as possible. If you develop a fever or a cough, please stay at home. Don't panic. Call the national hotline number, which is toll-free, and they will advise you whether you need to go to the clinic or hospital for testing or not. Please do not flood the clinics and hospitals, as the services need to be kept available for those who are really ill and need critical care. If you become short of breath or are having any trouble breathing, please come to your nearest hospital immediately. Please support one another, be positive, kind, and caring. Share accurate information from reliable health organizations, such as Department of Health, WHO, CDC, and USAID, and the government. Please do not share fake news, which will just cause panic. Together we can do this, but only if everyone pulls their weight. Please take note of the South African National toll-free hotline number 0800 029 999, and other useful platforms from our Department of Health, NICD, and WHO, offering accurate, up-to-date information on the coronavirus pandemic. Thank you very much and good luck. Thank you for watching this video. Please look out for others like this. The numbers that you can call.